question here. The nurse is preparing a client with an axillopopliteal bypass graft for discharge. The client should be tough to avoid. So the key point here, the client with the axillopopliteal bypass grafting for discharge. So in that, if patient have it, what are the important to avoid? Number one, using a recycler to rest. Number B, resting in supine position. Number C, sitting in a straight chair. Number D, sleeping in a right Sims position. The correct answer is sitting in a straight chair. So why it is correct? The client with a femoral popliteal bypass graft always should avoid the activities that can occlude the femoral artery grafting. So if they sitting the straight position, the axillopopliteal bypass should be obstructed. So it is important to avoid sitting that can occlude the femoral artery. Sitting in a straight chair and wearing the tight cloth are strictly prohibited. For this reason, the axillopopliteal bypass grafting patient never ever sit in a straight chair. Like another option, like I said, resting in a supine position or using the recycler or sleeping in a straight sim position. So in all are allowed if patient has a axillopopliteal bypass grafting, right? So the next question here, the doctor has ordered anti-thrombic stroking to be applied to the leg of the client with a peripheral vascular disease. The nurse knows anti-thrombotic stroking should be applied. Number one, before raising in the morning. Number B, with the client in a standing position. Number C, after bathing and applying the powder. Number D, before retraining in the evening. So this question is really important for Nclex board. Due to some unknown reason, Nclex board asks this question. They repeat it. So doctor ordered anti-thrombotic stroking, right? So because patient has a peripheral vascular disease, this is the other keyword. And so anti-thrombotic stroking should apply when and why? The correct answer is before raising in the morning, right? So the best time to apply anti-thrombotic stroking is in the morning before rising. If the doctor ordered them later in the day, the client should return to the bed. Wait 30 minutes and apply the stroking. The answer B, C, or D are incorrect because there is likely to be the more peripheral edema. If the client is standing or has just taken a bath or before uh, go for the evening walk, is it wrong? Because later in the evening, the more peripheral edema will be present. So before raising is the best option. Question here, the nurse has just received the shift report and is preparing to take the round. Which client should seen first? So this question about the prioritization. So out of 4 patients, who is more danger under the risks, you have to check first, right? Number 1 or A, the client with a history of cerebral aneurysm with an oxygen saturation 99%. So this patient has a cerebral aneurysm, right? But saturation of oxygen is 99%. So this patient is stable because oxygen is 99%. Number B, the client 3 days post-coronary artery bypass graft with a temperature of 100 or 100.2 degree Fahrenheit. Post-coronary artery bypass graft temperature is raised up, right? Inflammation process. Let me check number C. The client admitted 1 hour ago with the shortness of breath. Definitely it is the two priorities. Only 1 hour ago, shortness of breath. So you have to go and give something this patient because shortness of breath, maybe need oxygen, maybe any kind of obstruction the respiratory system. It is very important to check it first. So also another way to answer this question, I want to tell you, just follow A, B, C, D laws. Means A means we have to check the airway first, then we have to check breathing, and then we have to check any kind of circulatory problem or remove the patient for any kind of danger or just check for others disabilities, right? So airway the first priorities. So number C is the correct answer. Number D said the client being prepared for discharge followed a femoral popliteal bypass graft. It is a stable patient. So let me explain one more time. I said correct answer is C. The client is admitted 1 hour ago with a shortness of breath should be seen first because this client might require oxygen therapy. The client is in answer A with an oxygen saturation 99%. Number A is not answer because oxygen is 99%. It's a stable patient. Number B is not correct because this client will have some inflammatory process after surgery. So the temperature 100.2 Fahrenheit is not unusual because patient went for the coronary bypass grafting. Inflammation is active. And number D, the client also the stable and can be seen later. Right? Next question here. A client with a femoral popliteal bypass graft and is assigned to a private room. The most suitable roommate for this client is the client with a femoral popliteal bypass grafting. Key point. So out of these 4 patients, who should be the most ideal roommate? So same infection in the same room. A fresh patient will be another fresh patient. Pneumonia with another pneumonia. So it is called cohorting. It is very important. So number A said hypothyroidism. Number B, diabetic ulcer. Number C, ulcerative colitis. And number D, pneumonia. So the correct answer is number A, hypothyroidism. Why? So you see diabetic and ulcer because of infection. Ulcerative colitis infection, pneumonia, lung infection. Femoral popliteal bypass graft, patient is very sensitive. If this patient will stay with anyone, B, C, or D, the chance to get infected. But hypothyroidism is not an infection. It is the chronic thyroid disease. So out of 4 patients, the best roommate for post-surgical client is the client with a hypothyroidism. This client is sleepy and has no infection process. But answer B means diabetic ulcer, C, ulcerative colitis, and D, pneumonia are incorrect because the client with a diabetic ulcer, ulcerative colitis, and pneumonia can transmit infection to the post-surgical client. Next question here. The nurse is teaching the client regarding use of sodium warfarin. The key point is here, sodium warfarin. Which statement made by the client would require further teaching? Means I'm doing something wrong, you need to re-educate me. Number A, I will have blood drawn every month. Number B, I will assess my skin for rash. Number C, I take aspirin for headache. Number D, I will use an electric razor to shaving. So my patient taking warfarin is a blood thinner. So if anybody need to take blood thinner, need to check blood lab work every month. It is okay, nothing abnormal. Number B, I will assessment my skin for any kind of skin rash because it indicates the bleeding. So you need to go to the doctor office. So nothing wrong. Number D, say I will use electric razor. Yes, definitely. If anybody is under the blood thinner, you educate them to use electric razor to shave. Number C, I take aspirin. Definitely no. Aspirin and blood thinner can cause complications, right? So your patient can take any other medication like ibuprofen or Tylenol rather than aspirin. So the client who taking an anticoagulant like heparin or warfarin should not take aspirin because it will further increase the bleeding. And he should return to have a of pro-time draw for bleeding time, report any kind of rash, and use electric razor. It is important. Therefore, the answer A, B, and D are incorrect. The next question here. The client returned to the recovery room following repair of an abdominal aneurysm. So repair abdominal aneurysm, which finding would require further investigation, right? So abdominal aneurysm means artery wall is weaker, any chance to burst, and it is the medical emergencies. So if your patient has an abdominal aneurysm, which finding would require evaluate? Number one, pedal pulse regular, urine output 20 ml in first hour, blood pressure systole is 108 over diastole 50, and oxygen saturation 97. So which is one? Urine output is 20 ml, right? So it is important to inform the healthcare provider for next evaluate, right? Let me tell you, my patient has an abdominal aneurysm. Because of aorta is claimed during the surgery, the blood supply to the kidney will be impaired. So you see the return to the recovery room. So patient is get correct from aneurysm and now recovery room. So when abdominal artery is repaired, chance to blockage of blood supply to the kidney. So blood supply to the kidney is impaired. This can result renal damage. The urine output is 20 ml less than normal. We call oliguria. So the answer is A. We need to evaluate the kidney function test. Like pedal pulses are steady and regular are within normal limit because it is called regular. Blood pressure is 100, 850. It is desirable for the client blood pressure to be slightly lower after surgical repair of aneurysm. Oxygen saturation 97% within the normal limit, and so it is nothing abnormal. No need to evaluate. So answer is number B. Next question here. The nurse is doing bowel and bladder retraining for a client with paraplegia. Which of the following is not a factor for the nurse to consider? So examiner asking, nurse is doing bowel and bladder retain, client who have a paraplegia, right? So not a factor need to consider. Number one, diet pattern. Number B, mobilities. Number C, fluid intake. And number D, sexual function. So correct answer, you say, diet is important. Because if patient movement problem, if they do not eat enough fiber containing food, can develop the constipation. Mobility is important for increase the peristalsis, GI movement. Fluid intake is important too. But sexual dysfunction is not life-threatening condition. So we answer is sexual function. It is not a factor the nurse should consider right now. So when assisting a client with the bowel and bladder retaining, the least helpful factor is the sexual function, and dietary habit or history, mobility, and fluid intake are important factors. This must be taken into the consideration because they related to constipation, related to urinary function, and ability to use urinal or bedpan. Next question here. A 20 years old is admitted to rehabilitation unit following a motor vehicle accident. Which would be the appropriate method for measuring the client for practice? Patient came for motor vehicle accident. Appropriate method to measuring the client using the crutches is same. Number one, measure the 5-finger breadth or below under the axilla. Measure 3 inches under the axilla. Number C, measure the client with the elbow flexed 10 degrees. Number D, measure the client with the crutches 20 inches from the side of the foot. So which would be the appropriate method to measure? The correct answer is B, right? So measure the 3 inches under the axilla. Why it is the answer? To correct measure the client for crutches, the nurse should measure approximately 3 inches under the axilla. Is that correct? Number A, right? It is too much distance under the arm because 5 finger, it's too much. And the elbow should be flexed approximately 35 degrees, not 10 degrees, right? So this C is not answer. And number D say that crutches should be approximately 6 inches from the side of the foot, not 20 inches, right? It should be 6 inches, not 20. And this is 10 degree. No, it should be 35 degree, right? So number B is a answer. Next question here. So that nurse is caring for a client following a cerebral vascular accident. Cerebral vascular accident, the key point here. Which portion of the brain is responsible for taste, smell, and hearing? So which portion of the brain is responsible? The correct answer is C, right? Temporal. So why temporal is correct? Why not occipital, femoral, or parietal? Let me explain. So the temporal lobe is responsible for taste, smell, and hearing. Occipital lobe is responsible for vision, and frontal lobe is responsible for judgment or behavior. And the parietal lobe is responsible for any kind of ideation, sensory function, and our languages. But number C, temporal lobe is responsible for taste, smell, and hearing. Next question. The client is admitted to the unit after a motor vehicle accident with a temperature of 100 degree Fahrenheit rectally. The most likely explanation for elevated temperature is that. So, patient admitted because of motor vehicle accident, and when we measured the vital sign, we found temperature is 100 degree Fahrenheit rectally. So this is most likely explanation for why temperatures go up. Number one, there was a damage in hypothalamus. Number B, he has an infection from abrasions to the head and face. Number C, he will require a cooling blanket to decrease the temperature. And number D, there was a damage to the frontal lobe of the brain. So if we know what area in our brain regulates the temperature, then we can answer. So correct answer is A. There was a damage to the hypothalamus, because hypothalamus regulate our body temperature. So damage to the hypothalamus can result in elevated temperature because this portion of the brain helps to regulate the body temperature. And answer B or C or D incorrect, because there is no data to support the possibilities of infection, or cooling blanket might not be required. And frontal lobe is not responsible for regulation of the body temperature. Answer is A. Next question here. The client is admitted to hospital in a chronic renal failure. A diet low is protein is ordered. The rationale for low protein diet. So if patient have a chronic kidney disease, why we give them low protein diet? Number A, protein breaks down into blood, urea, nitrogen, and other waste products. And number B, high protein increase the sodium and potassium level. Number C, a high protein diet decrease albumin production. A high protein diet depleted calcium and phosphorus. So what are the rationale? My kidney patient has a chronic renal failure, means kidney does not work, right? And we know the function of the kidney to expel out the nitrogenous waste product. And the source of blood, urea, nitrogen, or waste product are the protein. So if protein is less, kidney do not need to work much. So our correct answer is A. So protein breaks down into the blood, urea, nitrogen, And chronic kidney disease, kidney does not work. So less protein, less blood urea nitrogen, less function of the kidney. More protein, more blood urea nitrogen, and kidney need more work, right? So a low protein diet is required because protein breaks down into nitrogenous waste and causes an increase the workload on the kidney. And number B, C, and D not related to the protein. Nobody said high protein diet decrease the albumin. High protein diet deplete calcium phosphorus. It is not a logical. Next question here. A client who is admitted with thrombophlebitis, right, has an order for heparin. Is a blood thinner. Medication should admin using A or N. Number A, buretol. Number B, infusion controller. Number C, intravenous filter. And number D, three-way stop port. So correct answer is infusion controller. So heparin and warfarin both are blood thinner. Warfarin we give orally, but heparin we give in IV or right or intramuscular. So we need infusion controller. So for the safety or to safely administer heparin, the healthcare provider should obtain an infusion controller. So you can calculate how much heparin should be delivered to the patient. It is safer. So too rapid infusion of heparin can result of hemorrhage. So the answer A or C and D are incorrect. And it is not necessary to have a intravenous filter or three-way stop port need for heparin. Next question. The nurse is taking the blood pressure of an obese client. If the blood pressure curve is too small, what should be the result? So patient is obese and you are using too small cuff, not appropriate cuff. Like a pediatric patient, you check the blood pressure by an adult cuff, or you use a pediatric blood pressure machine or cuff to the adult person, we will get a wrong answer. If my patient is too obese and cuff is too small, what should be the result? A false elevation. Number B, a false low reading. Number C, a blood pressure reading that is correct. Number D, a subnormal findings. So correct answer is number A, means a false elevated blood pressure. So if the blood pressure curve is too small, the result will be blood pressure that is a false elevated. And choice B, C, or D are incorrect. If the blood pressure curve is too large, a false low result will come, right? So answer C or D, basically the same meaning, a blood pressure reading that is correct, A, and D is subnormal. So anyway, cuff is too small a false elevated. If the cuff is too large, a false low will result. Next question. A 4-year-old male is admitted to the unit with a nephrotic syndrome, right? Only 4 years old, nephrotic syndrome. And he is extremely edematous. Because of nephrotic syndrome, patient is edematous. Decrease the discomfort associated with scrotal edema, the nurse should do what? Decrease the discomfort associated with the scrotal edema. Number A, apply ice to the scrotum. Elevate the scrotum on a small pillow. Number C, apply the heat to abdominal area. Number D, admin and analgesia. So correct answer is elevated the scrotum on a small pillow. Is the correct answer. The child with a nephrotic syndrome will exhibit edema, and our patient has extremely edematous. So elevated the scrotum on a small pillow will help with edema. Applying ice in contraindicated, or applying heat will increase the edema. So applying ice or applying heat, no, it is not good. It does not good. So administer a diuretics might be honored, but it will not directly help reduce the scrotal edema. Therefore, correct answer is number B, and choice number A, C, and D are incorrect.